Hypertension or high blood pressure is usually more prevalent as you age. However, according to the American Heart Association, nearly 20% of women of childbearing age may have hypertension. This week, we're talking about hypertension in younger women and the importance of knowing and staying on top of your blood pressure. With me today is Dr. Valerie Rader, a cardiologist at St. Luke's Mid-America Heart Institute. Thank you so much for joining us.
Thank you for having me.
So to start off with, what is hypertension and how does it impact our bodies?
So hypertension is a blood vessel problem where the arteries, which bring blood from our heart to our tissues, the pressure is high in those blood vessels, and it can lead to a lot of issues for the body, including things like heart attack, stroke, congestive heart failure, but it can also damage the eyes and the kidneys.
Okay. Now, how common is hypertension or high blood pressure in younger women?
So hypertension is more common as people get older, but for younger women of childbearing age, the risk is about 17% in those of younger age.
And are there any certain populations that this is more prevalent in?
Yeah, so African Americans have a higher risk of hypertension, and they also have higher risk of having hypertension in pregnancy and the disorders that come with that.
Okay, good to know. Now, what's important for young women to know and understand about high blood pressure?
So the first thing is knowing what your blood pressure is. So a lot of younger women think that because they're young that they don't have high blood pressure, but that's actually not true based on how many women of childbearing age have high blood pressure. And so it's important to know your numbers.
Okay. What are some symptoms that may signal that you could have high blood pressure?
So the first thing to note is not everybody has symptoms. And so some of the symptoms that can happen with high blood pressure, so things like headaches or visual changes, chest pain, shortness of breath, dizziness, or sometimes even anxiety.
Okay, good to know. Now, when we're talking about high blood pressure, what is preeclampsia?
So preeclampsia is what's called a hypertensive disorder pregnancy. So it develops in the latter part of pregnancy at 20 weeks or later, but it can also occur in the first 6 weeks postpartum. And it can be associated with issues with other organs in the body, including the brain, the heart, the kidneys, the liver, and the blood.
Now, for women diagnosed with preeclampsia, how many will have long-term blood pressure issues?
Yeah, so when they've looked at this, women at their 6 to 12 week postpartum visit, about half will still have high blood pressure. And they've looked at women at a year, and those who have a severe form of preeclampsia, about 40% will have high blood pressure. And they've also looked long term, and about half of women at about 10 years would have high blood pressure still.
Okay, so important to monitor.
Yes, correct.
Well, thank you so much again, Dr. Rader, for joining us.
Thank you for having me.
To find out more about high blood pressure, talk to your doctor or visit stlukeskc.org/blood pressure. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.